Hi, I'm David Eagleman, clinical professor of family medicine at Brown University. This is the 11th in a series of talks on talc hazards as an example of corporations foisting the externalities, which are making customers sick, workers sick, or polluting the environment, onto the public. In this case, they knowingly sold a product that contained asbestos that was going to be inhaled by users and cause cancer without providing any warnings. This talk is on ovarian cancer and talc and asbestos. I have talc and asbestos together because they're always together. Wherever there's talc, there is asbestos. That's why the diseases caused by inhaling talc are the same ones as those caused by inhaling asbestos, since when you inhale the talc, you inhale the asbestos. This is a talk on ovarian cancer in general and the evidence that exposure to asbestos or asbestos and talc causes ovarian cancer. First, start with a little bit of confusion. For the last 4 years, there's been a change in the view about the origin of ovarian cancer, and it's now believed that most ovarian cancers actually begin in the fallopian tube, which is the tube that normally carries the fertilized egg from the ovary into the uterus. Cancer in general. The body is made up of trillions of living cells. Normal cells grow, divide, and die. DNA damage causes out of control cell growth, which is cancer. Cancer spreads locally where it grows and also spreads throughout the body through the lymphatics and the bloodstream. A little bit of anatomy and physiology. This is female anatomy. The fallopian tube is in blue. The ovaries there are 2 fallopian tubes, 2 ovaries, 1 on each side. These are highlighting the ovaries on the left side. The female organs are the ovaries. They're the sex hormones. They produce sex hormones, and they also produce eggs for reproduction. An ovary is long, about 2 centimeters wide and 1 centimeter thick. It's almond-shaped. There's 1 on each side of the uterus. This is the uterus, ovaries, fallopian tube. As I mentioned, the fallopian tube carries fertilized eggs to the uterus. The incidence of cancer, 1 in 55 women get ovarian fallopian tube cancer. There are about 22,000 new cases per year. About 15,000 cases die per year. The rates are highest in developed countries. Ovarian cancer accounts for 3 to 4% of cancer in women. It's the 4th most frequent cancer in women. The highest rate occurs in women between 65 and 74 years of age. There are a variety of types of ovarian cancers. The main types are listed here. These are called epithelial. They were named because it was originally, before 2010, thought that they came from the outside of the ovary, but now it's believed they originated in the fallopian tube. The main types are serous, mucinous, endometrioid, clear cell, and transitional cell. Those are epithelial cancers of the female genital tract. After 2010, the idea has changed, science has changed, and now most people believe that fallopian tubes are the origin of ovarian cancer. Originally, since ovarian cancer was generally found late, most of the cancer enveloped the ovary. and the fallopian tubes are not really carefully examined. And that's the reason that it was believed that most of the ovarian cancers began in the ovary. We now see that that is probably not the case. Okay. This is a paper on this issue. The increasing frequency of tubal carcinomas and the associated decrease in ovarian cancer appears to be due to the reclassification of tumors previously classified as ovarian and greater emphasis on examining the resection specimens of non-uterine pelvic carcinomas. In other words, they started to look in the fallopian tubes, and the more they looked, the more they found. And what's happened over the past decade is the rate of fallopian tube cancers diagnosed from the fallopian tube has increased, and the rate of ovarian cancers has decreased. And that's really just because the name has shifted. Here you see the rates of fallopian tube cancers on pathologies increased, and the rates of ovarian cancer decreased. The stick is another name for ovarian cancer, beginning in the fallopian tube. There's been a decrease in the incidence of ovarian cancer from 2001 to 2014. Fallopian tube cancer has increased about fourfold. This increase is probably because of the change in diagnostic practices, early detection, and improved pathology. If you detect the ovarian cancer early, it's going to show up in the fallopian tube and not in the ovary. After 2012, the origin of ovarian cancer subtypes has been believed to be in the fallopian tube. Again, this is another paper citing the fallopian tube as the origin for all the various subtypes that I went over before of epithelial cancer. In 2016, WHO, the World Health Organization, took a survey of pathologists. At this time, a small majority of pathologists diagnosed ovarian cancers as tubal origin. A smaller percentage used the ovary, and 17 to 22% of pathologists and clinicians did not use uniform criteria. In 2014, WHO changed the ovarian cancer classification scheme. It used to designate it by histologic site, in other words, where it was found. But that lumped fallopian tube and ovarian cancer. This is no longer the case. At the present time, it's widely accepted that the origin of the most common type of epithelial ovarian cancer, high-grade serous carcinoma, originates from the fallopian tube epithelium, whether the fallopian tube itself or in the epithelium from the fallopian tube that implanted within the ovary. This is from a defense affidavit by Dr. Felix in the Prudencio case. Ovarian cancer originated from the fallopian tube. This is a paper by Kuman laying out the compelling evidence that most cancers of the ovary actually start in the fallopian tube. In fact, recently, people have suggested that women with a family history of ovarian cancer have their fallopian tubes prophylactically removed to prevent the ovarian cancers from occurring. Now, this is definitional issue about the origin and naming of fallopian tube and ovarian cancer has made the epidemiology confused. Most epidemiologic studies relied on pre-2004 diagnoses, which named fallopian tube as ovarian cancer. Some of the epidemiologic studies lumped ovarian cancer, fallopian tube cancer, and peritoneal cancers as ovarian cancers. But whatever you call it, they're related to asbestos exposure, most of these studies of asbestos-exposed women, this is women workers generally, combine all the epithelial ovarian cancers. Talc studies show a statistically significant increase in both serous and endometrioid and ovarian cell cancer. Epithelial ovarian cell, those are two of the epithelial types. Also, the P53 mutation is associated with high-grade cancers of the serous endometrioid transitional histology. That's important because P53 mutations are caused by exposure to asbestos. And what was endometrioid adenocarcinoma called in the literature? It was combined with ovarian cancer, split out separately. This is a study of a recent study of the NIH by Gonzalez, where they lumped all cancers designated as ovarian, fallopian, and peritoneal as ovarian. Again, another study by Kramer lumped all these three cell types together as ovarian cell cancer. Gabriel did the same thing. Barak also grouped all these cancers together. These last three were studies of women who were exposed to talc. Symptoms are bloating, pelvic or abdominal pain, difficulty eating, feeling full quickly, urgency or urinary frequency. The most common sign is late, and it's abdominal enlargement. The major histopathologic categories of ovarian cancer: 2, epithelial and germ cell. Germ cell cancers are not associated with talc. The epithelials, most of them are. The most common types are epithelial, it's about 75%. Germ cell and sex cord stromal are 15 to 20%. I went over the ages before. Lifetime risk here is a little bit different, 1 in 70. There are 3 main categories: benign epithelial tumors, low cancer potential, and then serious cancer potential. The average age of diagnosis is 60 years or so. Again, 15.7 per 100,000 women at age 40, 54 per 100,000 women at age 79. 1 woman at 70 will develop an ovarian cancer. It's generally a disease of postmenopausal women, women with a family history of breast cancer, and ovarian cancer may be diagnosed with up to 10 years earlier than the average woman. Under the microscope, you have serous, endometrioid, mucinous, clear cell. Most are serous. Stage 1, 5-year survival is good. Stage 2 is fair, 60 to 75%. Stage 3 and 4 are terrible. That's why it's important to diagnose it early or remove the fallopian tube. These are all the different types of cell types of ovarian cancer. Obviously, I'm not going to go through them all, but there are many. Risk factors: genetic predisposition, family history is strongest risk. There's a syndrome of breast and ovarian cancer, Lynch syndrome, which is cancer of the colon, breast, and endometrium, and that runs in families. Not getting pregnant is a risk factor for ovarian cancer. Family history risk factors is the strongest risk factor. Women with a first-degree relative with ovarian cancer have relative risk 3.6 times higher than those without a relative who has ovarian cancer, and a high lifetime risk of 5%. 5 to 10% of ovarian cancers are linked to identifiable inherited mutations. The main mutation is BRCA. Reproduction risk factors: no pregnancies is a risk factor. First child after age 35 is a risk factor. Involuntary infertility is a risk factor. Late menopause and early menopause are risk factors. Patients with prolonged periods or uninterrupted ovulation, risk factor. There are protective factors. Using oral contraceptive pills as a protective. Having a lot of kids, particularly kids before age 30, or tubal ligation, hysterectomy, bilateral removal of the ovaries, lactation, that is breastfeeding, potential role for retinoids, vitamin D, and NSAIDs as preventive agents. Those are less sure but possible preventions. Again, decreased risk, pregnancy, birth control pills, tubal ligation, hysterectomy, increased risk, infertility, endometriosis, post or perimenopausal, smoking, asbestos. Asbestos causes ovarian cancer. I'm going to go over some of the evidence for this phenomenon. But the first evidence I'm going to go over is evidence presented by the organization of the talc companies, the CTFA, who argued to the NTP that asbestos was a clear cause of ovarian cancer, and that asbestos in talc was a clear cause of ovarian cancer. Okay, and some background: in 2002, NTP proposed adding talc without asbestos to the official list of carcinogens. The company organizations, CTFA, and the companies themselves that manufacture and sold talc opposed this with a kind of unique argument. They called it the fatal flaw of the epidemiology. They claimed there used to be asbestos in cosmetic talc before 1976. They claimed that asbestos travels to the ovary after inhalation. That would be from talc inhalation. They claimed that asbestos causes ovarian cancer in women asbestos workers and in women exposed to talc. It explained the epidemiology. They claimed falsely that talc had been asbestos-free since '76. That was a lie. But their conclusion was that all epidemiologic studies of women included women who had been exposed to this pre-'76 bad talc with asbestos, and therefore the increased rates in the epidemiologic studies were due to asbestos in pre-'76 talc, so you couldn't rely on them for determining whether talc, quote, without asbestos, close quote, which really doesn't exist, but they argued did exist, could not be the cause of was not the cause of the excess ovarian cancers found in the epidemiologic studies that had been done up to that time period. Of course, this was not true. J&J knew and said that there were no clean mines, that is, that all talc mines contained asbestos. Imerys, the main talc miner in the world, also claimed that all talc mines contained asbestos no matter what their geologic origin. In addition, J&J told Health and Human Services in 1972 that talc cannot be processed to remove elongated particles, that's asbestos, from talc. So it's everywhere present in all talc mines, and you can't get it out. Nonetheless, their claims that the test method that they implemented in '76 or '77, called J4-1, removed asbestos from talc that was sold in the commercial market, convinced 12 of the 32 epidemiologic studies to cite the J4 test method as evidence that talc did not contain asbestos after 1976. So the lie was accepted by many of the epidemiologists who really didn't have any background in the product or the mining techniques, certainly weren't given the J&J documents, that there was no asbestos in talc after '76. Fatal flaw was expressed in a letter by McEwen, head of the CTFA, to NTP. Okay, here's the letter that they sent to NTP. was actually sent in 2004, but written in 2002. CTFA promulgated a specification. That's a test method for cosmetic talc to ensure that it was free of asbestos. They claimed that the specification was self-enforcing because there was no FDA enforcement and there was no company enforcement. They claimed asbestos had been listed as a known human carcinogen, was highly regulated, and the reason it was self-enforcing because no consumer products company would knowingly run the risk of asbestos being present in their product, even in minute quantities. This is a matter of public perception and potential litigation exposure. So they claimed because they were afraid of getting sued that they would never sell a talc product with asbestos. Well, rather than following that, they just convinced everybody it didn't have asbestos. Again, this is titled Historical Contamination of Cosmetic Talc with Asbestos from the same letter, claiming in '76 they promulgated a test method that eliminated asbestos from talc. But a test method can't eliminate the asbestos from talc. And as J&J noted, you can't get the asbestos out of the talc. This was again the fatal flaw. These were the assumptions of the fatal flaw. Talc contained asbestos 476. Asbestos in that talc caused ovarian cancer. The test method J41 worked, and therefore there were no asbestos-containing talcs in the market after '76. This is Rich Szynski of Imerys, the largest talc miner at the time, taking credit for the NTP refusing to list talc without asbestos, which doesn't exist, as a carcinogen. This is an email to his superiors summarizing their success. Make no mistake about it, our actions and decisions in the next few days concerning our strategy to fight this NTP listing may very well make the difference in this debate. The outcome of which, if negative, will likely be the most significant event in the history of the talc business. As we've been advised, the odds are very much against us at this point from keeping talc non-asbestiform off the list. As such, our submission might be laser sharp and in conformance with what our legal people advise. Our audience will be the Board of Scientific Counselors and the U.S. courts. Now, this is in the CTFA letter to NTP implementing the previous strategy. Asbestos has been listed as a known human carcinogen, is highly regulated, etc. These are studies showing that asbestos had been found in talc in 1968, 1976. It's quite possible there was, in fact, asbestos contamination in some brands of cosmetic talc prior to 1976. So this is CTFA, the industry organization, admitting that talc contained asbestos. Okay, and they admit asbestos was a known carcinogen. They also admit that there is epidemiologic evidence for a relationship between asbestos exposure and ovarian cancer, and they cite 6 studies. And they say this evidence is consistent with other epidemiologic and mechanistic evidence concerning asbestos carcinogenicity. These biologic effects of asbestos have been attributed to its fiber structure and dimensions. So these are the mechanistic basis for believing asbestos causes ovarian cancer, as well as properties such as fiber durability and physiochemical surface properties. And they cite papers indicating that this is why and how asbestos causes ovarian cancer. Such properties differentiate asbestos from pure talc and talc associated with calcite dolomites. Here we agree, platy talc does not cause cancer. But since it always contains asbestos, it causes cancer when it's used as sold. Here, CTFA summarized the data that supported a causal role for talc in cosmetics as a cause of ovarian cancer. It seems clear that some talc particles as well as asbestos fibers can reach the human ovaries. How this occurs is still unclear. It's not been established that talc particles can reach the human ovaries through vaginal translocation as a result of perineal exposure. I agree with that, but there is some evidence that talc, as well as other mineral particles of low toxicity and low solubility, can be transported to various internal organs through the human body's systemic circulation. That's absolutely true. That's how asbestos gets into the abdominal cavity of men and women workers, exposed, and causes peritoneal mesothelioma in the abdomen. It's how asbestos gets into the testes, and it's how it gets into the ovaries and has been found in the ovaries in women exposed to asbestos, either in talc or generally. They claimed that present-day cosmetics must be assumed to be free of asbestos because that's what their test method says. It is a marketplace requirement. It wasn't a regulatory requirement, and no one ever checked, and it turns out that the companies continuously found asbestos throughout the period after 1976. And in 2019, FDA found asbestos in J&J baby powder as well. Epidemiologic findings concerning ovarian cancer and cosmetic talc are extremely weak, equivocal, and cannot be considered relevant to present-day cosmetic talc. That's the false fatal flaw argument. Now, what is this? Here's a meta-analysis in 2018 by Penny Kempe. Hard for me to pronounce that, but there's the spelling. There was a statistically significant increase for all serous and endometrioid, which is more or less around 1.32. It's about a 30% increase. Another meta-analysis of just the 4 cohort studies found that every use of powder in the genital area had a statistically significant increase of 1.13. Recall that when genital powder is used, it's also inhaled. There was a dose-response relationship found in the cohort studies that was statistically significant. So the higher the dose, the more ovarian cancer. After the NTP withdrew their recommendation, IMRIS developed a plan for actually removing cosmetic talc products from the market, despite that finding. And they drafted a proposed letter to the FDA and NIH. Given all the scrutiny during the last decade of cosmetic talc, and they have it in quotes here, and that's quite appropriate because there's no such thing as cosmetic talc. Cosmetic talc is talc used in cosmetics, but it's no different, comes from the same mines that also contains asbestos. Given all this scrutiny of the last decade of cosmetic talc and its association with ovarian cancer, Luzenak cannot imagine that an additional review by NTP would result in a reversal of consensus among the scientific validity of this hypothesized association. But given the sensitive nature of the very serious health issue, women's health issue, and the lingering suspicions of ongoing suspicions concerning cosmetic talc as a possible risk factor, Luzenak would like to propose a remedy to FDA and NIH that would eliminate the need for further debate and review of this issue. We propose The talc industry in the United States will voluntarily phase out production and sale of all cosmetic talc products used specifically for the consumer dusting powders, body powders, baby powders, and any other loose powder products that might reasonably be anticipated to be used by women for perineal application. The voluntary withdrawal would not include such products as medicated foot powders where it would not be reasonably anticipated that the product would be used for perineal use. But it would still be inhaled, so it would still be a risk. The CTFA will assist FDA in developing an appropriate cosmetic warning label for any dusting of body powders containing talc which are produced or imported after an established date. The label would warn the consumer the product is not to be used for genital dusting and would report of the possible association between genital dusting and ovarian cancer. Now, as noted above, CTFA recognized that inhaling talc could also produce cancer in the ovaries through blood transmission. The result of these proposed actions would, in very short order, virtually eliminate the exposure potential in the general population of dusting powders containing talc, as more and more dusting powders have already been reformulated and will increase the level of cornstarch. Proposed actions would accelerate these product conversions. So IMRIS recognized that cornstarch was an adequate substitute that was already being used instead of talc in many cosmetic products. Eliminating the perineal exposure for women suspends the need for NTP to proceed with a review of cosmetic talc. They were afraid the NTP would re-review the talc and list it as a carcinogen. Again, in 2019, after all this, the FDA found asbestos in J&J baby powder. These are some pictures of chrysotile asbestos found by the FDA lab. R.J. Lee also found asbestos in the J&J baby powder. They changed their results and backdated the changed results, claiming the original results were from somehow contamination that was unspecified. The Bureau Veritas also found asbestos in J&J baby powder, another industry lab. Nonetheless, J&J stands by their findings in J&J baby powder, claiming that they've never contained asbestos. The Hill considerations for asbestos and increases the risk. This is a review that I did with others. There's strong association. It's biologically plausible. Experimental evidence indicates it's probably the case. There's a dose response. It's analogous to other ovarian carcinogens. The findings are consistent. They are biologically plausible, as stated by CTFA. The exposures occur before cancer. It's not specific since asbestos causes a variety of cancers. That's the end of this talk on ovarian cancer and asbestos talc exposure.